So my name is Olga Klepitskaya. Sean did a great job saying my last name, but my patients called me Dr. Olga, Dr. K. Anything is accepted as long as it's comfortable for you to say. I am originally from Russia. I actually was a neurologist in Russia, and then took a chance to move to this country and went through training again here in this country. I had my internship in Chicago, then residency in neurology at the University of Colorado here in Denver. Then I left for 1 year and did my fellowship training in movement disorders and deep brain stimulation at Stanford University in Palo Alto, California. And I like Denver. I came right back here, and now I'm at the University of Colorado Neurology Department and working with different variety of movement disorders, mostly Parkinson disease, and mostly deep brain stimulation surgery, which is my interest and my passion. Well, patients here are with Parkinson disease. Although we are doing deep brain stimulation surgery for many other conditions, the majority of patients are patients with Parkinson disease. That's what I will be concentrating on today. I know that most of you can talk about Parkinson disease, probably maybe even better than I do, because you know insights of this disease, you know a lot of this disease, and you feel this disease. So if I say something you already know, please forgive me, but I'll say something for some people who probably don't know some.
We can't see the slide with the overhead lights on.
That's right. Sean promised to adjust it for me. Thank you. Do we have to do what? I think people will fall asleep in this darkness. Is it okay now? Not too dark? Not too bright?
As long as you can read your notes.
Oh, I know. They're up here. It's fine. All right. Parkinson disease was first described by Dr. James Parkinson in England in 1817. And this is the picture. Probably you've also seen that before. Historic essay on shaken palsy. That's how Dr. Parkinson called Parkinson disease. Well, actually this name is wrong. As most of you know, Parkinson disease is not only shaken and not even always shaken. And by any means, it's not a palsy, because palsy is a weakness, and patients with Parkinson disease maybe can feel generalized weakness and fatigue, but really there is no muscle weakness. And if somebody does have muscle weakness, we have to think about something else. So, but that's how Dr. Parkinson called the disease, which eventually started carrying his name. And this picture is also from his monograph, which really greatly represents the typical picture of Parkinson disease patients. Stooped posture, little bit bent arms, and that was part of the essay of shaken palsy. Well, I'm very happy that this auditorium is full of patients and patients' partners who came to listen to me today. But you know, you did not come here today, all these people did not come here today because I'm such a famous doctor. Well, I'm trying to be one day, but not yet. The auditorium is full of people because Parkinson's disease is a very common illness. And this is one of the latest paper in our main neurology journal, which really asks a question: how really common are what we call common neurological disorders? And here you can see that headaches are very common, Alzheimer's disease very common, but in elderly people, in the population over 65 years old, Parkinson's disease and stroke are the most common disorders and can happen in every 10th person over the age of 65 years old. But we know that Parkinson's disease does not happen only in in older people. Younger people can have Parkinson's disease, and we do have some patients in this audience who unfortunately got Parkinson's disease in much younger age. So Parkinson's disease is a common neurological disorder. And with the aging of the population, the number of people affected by this disease will increase. Another paper from Neurology Journal from this year again, which showed projected growth of number of patients with Parkinson's disease in the major countries, biggest countries of the world. And here we see that China actually will have significant increase of this disorder, followed by European countries and United States. This other graph also confirms this postulate. So this in blue, which United States colored in blue here, we can see that growth of Parkinson's disease population will be quite significant in the next 25 years. And the population with patients with Parkinson's disease, number of patients with Parkinson's disease will probably double. Well, again, you know that, but I will just list briefly that Parkinson's disease affect motor system, in other words, affect movements of the patient. And it characterized by what we call three cardinal features. This is tremor, and tremor in Parkinson's disease happening mostly at rest. Slowness of the movements, which we call in medical language bradykinesia, and muscle stiffness, that we call rigidity. It also can affect some other aspects of movements, and unfortunately many of you are familiar with those. Poor balance, which in advanced disease can result in frequent falls, difficulties walking, stooped posture, just like we saw on that picture before, poor facial expression, we call it masked faces, and very often patients with new disease who does not know that he has Parkinson's disease yet will come to the office and tell, you know, people tell that I'm sad or depressed, but I'm not really sad or depressed, but that's because muscles in the face become stiff and rigid, and patients do not express their emotions as easy as patients who are not affected by Parkinson's disease otherwise would. So, and voice and speech, unfortunately, is affected in most patients. Up to 90% of the patients have problems with voice and speech, and it can be very soft voice. Common story we hear, and maybe some of you will confirm that. Patient will come to me and tell, well, my wife doesn't hear very well. No, that might be a case, but what usually happens, the voice is so soft, but patients do not perceive their voice as a soft and not that loud. Slurriness of the speech can happen, and before I forgot, up front where Sean was meeting you, I put some flyers about speech study which is being conducted now by National Institute for Voice and Speech in Denver. It's located in downtown Denver, and it's supported by NIH grant, and they test specific type of voice and speech therapy for Parkinson's disease. Please grab one of those flyers and see if you would like to participate. The effect is quite good. Well, and obviously handwriting is impaired. All of those type of movements are impaired because they're slow, muscles are stiff, and tremor is affecting them too. Well, recently we found out that Parkinson's disease is actually not only the disease of motor system, not only the disease of movements, variety of other functions of the body are affected. And recently it was discovered that actually one of the first symptoms of the disease is decreased sense of smell. Nobody usually thinks about that much. It's not a disabling problem usually, but when you ask patients, what about your sense of smell? Many of you will tell that, oh, you know, that's right, I couldn't smell for years, I didn't think of that.